this is a new year, so one of the things I think is most important is that we kind of take a reevaluation, not necessarily make new resolutions, but make real promises that we're going to keep to ourselves. And part of that, as we talked about before, Lori on the show, is dealing with our health. We see as some of us getting older, we see some of our parents or family members, how they might be slowing down and things are happening with them. And part of that has to do with their health and how they eat and how they exercise and things like that. And so there was something I thought was very interesting dealing with an article pertaining to health within our community. And I want to know what you thought about that, Lori, and how you think we can move forward to kind of resolve some of those issues and problems.
Well, I thought it was very interesting because it's commonly known within our community that there are several diseases that are more prevalent in our community than in others,
Right.
Diabetes, high blood pressure, glaucoma, things of that nature. And over time, we really need to make sure that these things are studied because there has to be a logical reason for it. And although I've heard and read in the past about various studies that introduce the fact that melanated people will have you have something in your body that is a chemical that when it interacts with other things it may have a different reaction than it does in other cultural groups. And so it's something that probably needs to be studied a little bit more. But the article was pointing out that over time they have been studying some of these things and they've been trying to make the results more accurately reflect the average amongst the the human population, and they haven't been successful yet. Over I think that the target date was 2010 that they expected things to kind of average out within our community, and it hasn't been successful yet. So they're continuing to study.
What do you think what do you think is the reasons why we're not doing well in those particular areas in terms of our health burden? I mean, can we point out some of those things? Because obviously, let's take, for example, diet, for one thing.
Well, diet is a family thing. It's a cultural thing. They did a study not too long ago, and it found that the weight gain, the obesity,
right,
is contagious. Look at the way you look at me. It's contagious in the sense that not like a flu or other conditions. It's contagious because it's sort of a family or cultural thing within the community where if a mother is obese, her sister may be obese, her daughter, the family unit, because there's a social acceptance within that unit of obesity. And a study came out, I think, last year about that. And what it is dealing with the problems of the minority community, particularly the black community, having a problem with 14 out of 16 indices of health, which Laurie mentioned, glaucoma and diabetes and strokes and heart attacks, all of those different forms of cancer. We're bad off and worse in 14 of 16 nationally. And the National Institutes of Health had a unit to put in over a decade ago, and as Laurie said, to have at least by 2010 an improvement in the disparity ratio of blacks to the white population. It shouldn't be that the breast cancer blacks have a 3 times the higher mortality rate than whites, and black men with prostate cancer shouldn't be graded or 3 times higher than whites. What is that? What causes that? There's many factors besides race, health, ability to have health insurance and all that.
Well, let's talk about some of those factors because obviously people make an assumption that, these things happen in these communities because people are not taking care of themselves, and that might be part of the conversation. But also when we talk about the Affordable Care Act that's out there, okay, part of the problem is getting quality health care in our communities.
Yeah, and they were looking at the fact that, poverty levels are going to contribute, how often you're going to wind up going to the doctor, how often you're going to eat fast food versus healthy food. All of these things are going to contribute towards your general health. And as Bert mentioned, whether it's hereditary or it's not hereditary, is subjective, because
Right.
sometimes people, it's not your genes. A lot of people would say, oh, I'm big boned, or we have a family that's big boned, things of that nature. But sometimes it's the behavior. You're used to
Right.
eating fried foods in the South. You're used to eating, a lot of foods. It's interesting because just today came out a study came out about the worst foods in the country.
Right.
And the Cheesecake Factory, they mentioned, had two notches on the list. One of them was like their pasta and shrimp, thing that had 3,000 calories, which is supposed to be like 4 or 5 days worth of the calories you're supposed to have, and the saturated fat content was something ridiculously high. So, it's, and their response, when they questioned them about it was, well, when people are celebrating, as they normally do when they come here, they're not looking, to be concerned about stuff like that. This is a celebration. And it reminded me of Paula Deen. She was on a show one time, I think it was Oprah, and then Oprah was saying, wow, but that's a lot of calories. And she said, well, I'm your cook, I'm your chef, not your doctor. So a lot of people are just justifying, saying, look, go crazy if you want. It's not our responsibility. So, and the reason I mention that is because it just puts the onus back on us to take care of our health and not rely on what is being given to us.
So when you get people around you that are positive people that can encourage you, I think that you can make those life modifications that you need to make in your life so you can survive. This is about, you being able to have quality of life. Now, Laura, you said something before I just thought was interesting, because, when I was heavier, I thought that was normal. Right.
Yeah, and you get used to a certain norm until that's not your norm. And it's just like when people don't exercise, you're thinking, okay, well, this is fine. But when you exercise, you start feeling more energy,
right.
You start feeling better. Then if that becomes your new norm, then you really, you can adjust, because as you stop exercising, you feel the difference. You may be more sluggish or things of that nature. And it's the same thing with the foods that you eat. Until you actually start eating fruits or vegetables and things like that, you don't really understand the difference that red meat has in your body. Doctors will tell you that red meat takes a long time to digest in your body. It's not saying don't eat it, but recognize that there's going to be a difference with things like that. And another thing in the news right now is that Coca-Cola now has a campaign where they're trying to target, the problem of obesity, and they're actually acknowledging that their soda can cause obesity. So a lot of people are looking at the fact that, okay, now that you know it, the onus is on you to do whatever you need to do in order to adjust your behavior.
Now, Bert, when we look at our community and we compare it to other communities. We look at the economic situation. We look at the infant mortality rate. We look at all of these different indices that you said are out there. The question has to be, how do we resolve that issue? And if we had such an initiative out there, I said before in the pre-show that I don't remember anything going on within the community that I was aware of that was happening through the federal government to kind of target these groups, which are at the bottom of everything. So, I mean, they talked about the barbershops, they talked about going to the churches, and I think those are important things. But sometimes you got to get on the ground and maybe go to the projects, maybe go to the communities and reach out to people so they understand there has to be some type of change they make in their lives and make a difference.
This article, which is a very good article, pointed out something you just mentioned, barbershops and churches, where the major improvement they went back beyond 2010 that they have experienced up to now came in testing. Black females have a tougher time with breast cancer because they wait much later to get diagnosed and then following through with treatment, and which that is another issue. But the point is that getting to the information that will chart your course, determine the direction you go in terms of following through with your health is important. Now, this study also said that, I want to go back to churches. The churches were very effective, they're saying, in at least stemming the problem of people not getting tested for all forms of, for obesity, in terms of what we're always talking about, food intake, getting tested for different forms of cancer. Those tests were important, but the overall problem is they're realizing how intractable and difficult it is to get a group, particularly in the southeastern United States, where the poverty level is high, the health level is low, and the many factors that affect them in education also is a factor that they don't have enough information. That is the big issue down there. That's why I appreciate what the mayor is doing, because education doesn't always work. Just education and learning what foods to eat, learning how to manage yourself in terms of medical appointments. How often do they get a chance to go get to a doctor? The big goal that the mayor is doing. I still think it's a great idea just to bring attention to it, to the problem of obesity and its effects that it has in the community.
Yeah, even learning about portion sizes. I mean, most restaurants you go to, they'll give you, I know a friend of mine said when he goes to a restaurant, he will sit with his date and they'll actually share a meal because it's actually enough for 2 people.
Yep.
And we've just gotten used to larger portions, and that's just become the norm. So it's something that we have to, you know, and in fact, in the electronics show last week, they have a new gadget that's supposed to be a fork or a spoon that tells you when you're eating too fast. You know, and it's supposed to, you know,
Stop, Greedy. Slow down, Greedy.
Lori mentioned normal. What's normal? What's accepted as acceptable, normal, and the way to look and behave in terms of your appearance and weight. Normal. That's a big problem.
And the thing that I think is interesting about the conversation is that when we look at what is offered in communities of color, you can find fast food places up and down a row. You can find Chinese restaurants, but you can't find a supermarket with fresh vegetables in it or fresh fruit in it. And I know that there was a lawsuit that was going on in California at one point where one of the city council members was complaining. They said, before you build not one more fast food restaurant, we need to have some place, a holistic place built where people have that alternative in their communities. And so I think that that's the part that we have to kind of change around. I know we talked several times, Lori, about that. You know, going to McDonald's when we were growing up 100 years ago, right? Was like a luxury. We didn't go to McDonald's all the time. We had a home cooked meal and things of that nature. I didn't sit in front of the TV. I was outside running around. I played football, basketball, baseball. I did all those different things. The culture has kind of changed. It's made people lazy. It's made people more disconnected. Matter of fact, I was just listening to, I think they in Texas is going to open up its first, library without any books. It's all electronic now. What do you call those, e-readers or whatever?
E-readers, yeah.
Yeah. So I mean, technology has come so far now, and I think the problem is that technology can't exercise for you. Like I was listening to some person saying, "Well, is there a pill out there that you can take so that I can lose weight and not have to exercise?" Now, how lazy can you be? I mean, I understand it. You know, I want the supersize, right? I mean, let's be realistic about it. But guess what? I want to be around.
Yeah. And you really, I think you can't overstate the importance of, you know, concentrating on how you will feel. It's just like a smoker. If you're a smoker for years, after a while, you don't realize that you're out of breath when you walk up, you know, half a flight of steps.
Right.
You know, but it's when you quit, and you have quit for a long time, that you realize that, wow, this is, you know, I can walk a mile, or I could, you know, do things that I never used to do. It's really not about the aesthetics, it's about the way you feel, and I think that's something that needs to be put in the school system. I think it's something that children need to, you know, learn so that they can even pass on to their parents. You know, like kids come home and say, Mom, don't smoke. You know, they can come home and say, Mom, let's eat more healthy, but they have to know why and know why it's beneficial.
There's a question that you posed, because I'm always looking at the other end, the two sides. The government, as you said, where has this information been? How come you're not aware of it? There's another side in terms of the community developing the resources and infrastructure to demand information be dispensed to them, that they are in a position that the government will be required on a regular basis to deal not with this information, but the personnel, to articulate the information and to give them counseling and support to the doctors and the community in terms of the whole health array. That is an area, I'm glad to see the churches with that testing thing, but it should go toward advocacy to strengthen the effort of the community to get this working for them.
And part of that advocacy part has to be the Health Care Act, right?
Yes.
Because when we talk about that and you look at the initiative to try to repeal it, what communities are going to be most impacted by that? because we know that these communities don't have health care. This is supposed to be providing health care across a broad spectrum. And even though I still don't like the idea of not having more choice, I think this is probably the best we're going to get right now. And so I think that when people look at that, they have to kind of be more boisterous about what is going on.
More voices and vocal.
Yeah.
That's right.
Yeah, and I think another thing,
Vociferous.
not to get on the corporate greed comment, but
Yeah.
we also have to look at the fact that corporations, I think, aren't taking the responsibility that they need to take in some of these things. Just like, Cheesecake Factory could say, look,
Right,
it's not our problem, it's yours that we're giving you 3,000 calories and you're eating it. I think we need to look at the fact that, even if you look at breakfast cereals, they're adding more sugar, they're adding chocolate on top of it. There's just so many things that they're doing that are just trying to, increase the need for these addictions. And
Right.
you listen to these doctors, whether it's Dr. Oz or any of these other doctors, and they're telling you that a lot of these foods are sweetened with things that are artificial sweeteners that are like 10, 20 times more sweet than sugar. And they're not doing any beneficial, they're not being beneficial to your body, but they're getting your taste buds used to that level of sweetness. And so now you can no longer taste the sweetness in fruits, and that's just not good enough for you. And then you want, even now, I saw a commercial the other day for gummy bear vitamins for adults, and I'm thinking, come on, I could see maybe trying to get your kids to take vitamins and giving them, but adults should be responsible enough where you can swallow a vitamin pill without it tasting like candy.